This is how historical trauma works. And because I want us to look at it and see how it works. Because like I said, I do research. So the first phase entails the dominant culture, whoever feels like they're part of the dominant culture, perpetrating mass traumas on a population. So we see a lot of mass traumas on a population, right? And what happens is it results in cultural, family, societal, and economic devastation for that particular population. So this is the phases of historical trauma. So we have the first phase, then we have the second phase. And the second phase occurs when the original generation of that particular population responds to the trauma, showing biological, societal, and psychological symptoms. So let's think about Holocaust. Let's think about colonization. Let's think about enslaved individuals. So the first phase is definitely perpetrating those mass traumas on that particular population or group. Then the second phase occurs when the original generation of that population responds to the trauma. So it shows up in their body, it shows up in the relationships they have with other people, and it shows up psychologically. What are some of the things that's going on mentally and emotionally? But then this is where it shows up in the now. The final phase is when the initial responses to trauma are conveyed to successive generations through environmental, through psychological factors, through prejudice and discrimination. And so definitely, what symptoms are you seeing in your clients, your patients, yourselves as it pertains to the effects of historical trauma? You all said a lot of different things. There are so many things that you're seeing in the now. You all talked about anger, self-destructive behavior, substance use, suicidal ideation, hypervigilance, intense fear, disassociation, poor affect, survivor guilt, depression, PTSD symptoms. You all talked about numbing, fixation to the trauma, somatic symptoms, low self-esteem, victim identity. And the result of these events is experienced across generations. Across generations. Across generations. What are some other symptoms you all see? Unresolved grief, identification with death and dying, nightmares, memory loss, denial, depersonalization, isolation. What are some of the things you all experiencing? And I'm going to share this with you. So Tara said, as a result of trauma, repression, disassociation, denial, alcoholism or substance use, depression, doubt, helplessness, and devaluing of oneself and one's culture. So Tara said, this is the things that are happening in the now. Also, intergenerational legacy of shame, guilt, and distrust gets embedded in people's collective memory. And Sotero says that it's passed down through 7 generations. 7 generations. And so you're wondering what's going on? Did we even ask? Did we get curious to want to know?